High-cost housing can significantly impact the health of populations, especially individuals and families of low-income status. Ada County in Idaho is home to the most urban population in the state, as well as the state capital, Boise. My name is Brandy Sellover, and welcome to this presentation on the impact of high-cost housing in Ada County, Idaho. High-cost housing is defined as when people or families are spending 30% or more of their household income on rent or mortgage. The high-cost housing issue in Ada County, Idaho is important to the community because it impacts more than 1 in 3 people living in its boundaries. This is a social issue that influences the overall and long-term health of individuals, children, and families in ways that limits expenditures for other necessities such as food, medical care, and other important life requirements. High-cost housing is associated with very high housing costs in Ada County, which indicated that more than 13% of residents pay half to more than half of their income on cost of housing. The population most affected for the issue of high-cost housing in Ada County are families making less than $35,000 per year. Many of these families are paying 30% or more of their incomes toward monthly housing costs, and as opposed to families who make more than $35,000 per year, having 20% or less of their monthly incomes going toward housing costs. Unfortunately, there is no cross-cutting data available to indicate race, gender, or age within relation to high-cost housing. Nearly 1 in 5 families in Ada County have a total family income of less than $35,000 per year, and more than half of families in Ada County are middle to upper middle class, making between $50,000 and $149,000 per year. The median income for families in Ada County is nearly $70,000. The community practice of very high housing costs with a lack of affordable housing options in the area requires families and individuals, especially those from low-income experiences, to engage in high-cost housing endeavors, where significant portions of their incomes are going toward rent or mortgage and leaving little for food, utilities, and other necessities. In an effort to address solutions to the problem of high-cost housing in Ada County, an organizing process of establishing a community stakeholder team would be implemented. These vested stakeholders with a shared purpose horizon would address structural and systemic issues related to high-cost housing practices and the overwhelming consequence impacting families with limited income. Community stakeholders were identified on a basis that they are both connected to the issue at a personal and/or community level, and they would have significant contributions to the overall vision and mission of the project. Low-income families, including families and friends allowing other members to live with them due to high costs of housing, could contribute personal experiences, stories to ensure there is a personal face on the issue. City and county services could contribute subsidies for county or city utility services for low-income families with 30% or more housing costs, as well as these many other local stakeholder services and advocate organizations, including minimum wage increase advocates, food bank organizations, domestic violence and sexual assault programs and state coalitions, such as the Women's and Children's Alliance, and local businesses who support a thriving economy. Additionally, mortgage lenders like the Idaho Housing and Finance Association could be natural access points to provide affordable, fair housing resources for low-income families and individuals. Realtor associations and professionals can be effective advocates and publicly support affordable housing options for all families and individuals in Ada County so that the economy thrives. The list goes on. However, we would also want landlord associations represented, as well as the state and district public health departments on board as structural and systems level supports. And finally, to ensure that groups from populations most affected by low-income issues like minority advocate networks representing the needs of families and individuals from communities of color, as well as mental health and disability organizations, to advocate and protect and promote affordable housing options for low-income families and individuals from the disability and deaf and hard of hearing communities. We envision a world that is interconnected and liberated from health disparities that are socially constructed barriers for certain populations. The impact on high-cost housing in Ada County through this strategy would be integral to support social change in the community and narrow the gap. And our shared community vision is that every person has access to affordable housing in Ada County. Our shared community values are mutual respect for all persons, social equity for all persons where everyone has access to what they need to thrive, empowerment of all persons so they can reach their full potential. Through the community themes and strengths assessment, we found that the issue of high-cost housing directly impacts the overall health of low-income populations, more than 33% of people in the county, and that when a large amount of families' income is going toward housing costs, this creates a sort of cascade effect for the long-term health and quality of life through causing food, medical care, and mental health, as well as other necessity scarcities, because there are not enough funds left to cover those costs too. Community assets to address the manifestation of high-cost housing issues in Ada County are intervention-based and include city, county, and nonprofit organizational programs to assist with helping financial ends meet by paying obligations like utility bills, providing food and toiletry items when groceries are short, free and low-cost dental and medical care, rent and mortgage assistance programs, free legal services, as well as property tax reductions, free clothing, and no-cost counseling of all types. The local and public health system assessment highlighted the activities of the Central District Health Department, which is a separate but contracted entity with the Idaho Department of Health and Welfare. CDHD provides all direct gap-filling services that serve residents who may be experiencing issues related to high-cost housing, like medical and dental services on a sliding scale, response and regulation of environmental and community health issues, as well as immunization services, reproductive health, and the implementation of the WIC program within the county. A gap in service coverage was identified in which many families who experience financial stress from high-cost housing make too much income to qualify for the sliding scale. However, the available income to pay for the medical care may be exhausted by the cost of rent or mortgage. The assessment also found that Central District Health Department does not directly address any issues to actually prevent high-cost housing, and this could be addressed in a more robust way by publishing a public value statement of how housing insecurity and the high cost of housing impact the health of the community, and make recommendations for public entities to address the issue, as well as make policy changes to increase the benefits for the sliding scale to include individuals' non-discretionary expenses when considering coverage. The Community Health Status Assessment uncovered that families making less than $35,000 per year were most impacted. This group has 30% or more of their incomes going toward housing, as opposed to those making more than $35,000 per year, only paying out an average of 20% or less in housing costs. And again, this assessment reinforced the understanding of behavioral factors contributing to the issue of high-cost housing, where the cascade effect requires families and individuals to engage in high-cost housing endeavors, causing limited resources and a scarcity of food, utilities, and other necessities. And finally, the Forces of Change assessment, or policy assessment, highlighted that many citizens believed that Boise's city government was failing to address and provide necessary shelter for a growing number of homeless people and families, some due to the high cost of housing. Through a commissioned housing needs analysis, subsidized housing and rental assistance vouchers were recommended to be allocated to low-income earners to assist with filling the gap caused by high-cost housing. Also, the needs analysis highlighted the resources and policies already in place. Those include transitional housing programs through shelters, as well as the rapid rehousing Housing First, and permanent supportive housing model programs in Ada County. It is important to point out that current housing and urban development, or HUD, policies for affordable housing issues currently allow rent to be set at 30% of the annual income of a family. Future and planned policies that could directly impact high cost housing include the understanding that in the areas of the county where many of the quote unquote affordable homes are located are also older and many in disrepair. Also, the infrastructure of those neighborhoods are not well maintained, which potentially create deeper housing cost issues for these families. There has been a decline in funding sources for housing and community development in Ada County, which is having a negative impact on building affordable homes for the populations that need them the most. Through the MAPP assessment process, 3 strategic issues were identified that are either directly or indirectly tied to the health problem to be addressed in this order. Strategic issue number 1 is affordable housing mortgage policies under the Housing and Urban Development in Ada County currently allow for up to 30% of an annual income to be allocated for housing costs for families within an annual income of less than $35,000. And the goal for issue is to reduce the percent of families within this target group to 25% through strategies such as capacity building of Boise City Council and Ada County Commissioners on impact of high-cost housing on low socioeconomic families and children. Engage and organize community stakeholders within these target neighborhoods to petition for a city and/or county ordinance or regulation requiring a cap of no more than 20% of families' income to be allocated for a mortgage. Develop and disseminate a social marketing campaign targeted toward lenders providing mortgages to low-income families with annual incomes at or below $35,000, containing information on the impact of high-cost housing on low socioeconomic families, and a strong action request to shift these policies and practices for providing low-income families with mortgages that require more than 20% of their income. Strategic issue number 2 is families in Ada County which own or rent a home with 30% or more of their income going toward housing also have children lacking in food, clothing, and other necessary resources. And the goal for issue is to increase the percent of families in this targeted population who are currently receiving supplemental housing assistance to 25% through strategies such as capacity building of key community stakeholders who currently have supplemental funding sources to assist with housing costs on the impact of high-cost housing or low socioeconomic families and children. Engage and organize community stakeholders to shift their policies and practices on centering resources specifically on families within this demographic. Develop and disseminate a social marketing campaign targeted toward organizations with the capacity to provide supplemental housing grants and contain information on the impact of high-cost housing on low socioeconomic families, as well as strategies to provide support. Strategic issue number 3 is housing in neighborhoods located in affordable housing regions of Ada County are in disrepair and the infrastructure is not well maintained and located farther from accessible resources. And the goal for issue is to increase the percent of funding sources for housing and community development in specific regions of Ada County by 10% through strategies, again, of capacity building of those key stakeholders, engaging and organizing community stakeholders within these target neighborhoods to communicate the issue and require funding increases for housing and community development. Strategically engage media sources with information on prior reduced funding sources for the neighborhoods and use the coverage to encourage support within the community and the City Council for increased housing and community development funding. So thank you very much for participating in this presentation on the impact of high-cost housing in Ada County, Idaho. The references are as follows, and I look forward to your comments.